Since his appointment this summer, Health and Welfare Director Alex Adams has made it clear that fixing problems with Idaho's foster care system is his top priority. After budget requests and shakeups in the administration, the department has already enacted some big changes. But the stakes are high when it comes to child welfare. Producer Ruth Brown sat down with a woman who recently aged out of foster care about her experiences with the system, as well as Health and Welfare's Monty Pro to discuss future plans for change.
Cadence Wright first went into foster care at age 9 and again at age 14. The second time she was removed from her home, she never returned. She's seen different group homes, different schools, and felt the frustration that comes with the lack of stability. Now 18, Wright feels the need to share her story.
They started with a psychiatric hospital because they did not have any placements for me. And after that, it was a group home and then a foster family.
The instability continued for years.
I've had 18 different placements. 3 of them were foster families. The rest of my placements were shorter term group homes and like Airbnbs and psychiatric hospitals, and occasionally some respite homes.
The Idaho legislature passed a bill to stop the use of Airbnbs, or temporary homes, to house foster kids. It's something Health and Welfare began using due to a shortage of foster parents. Wright was familiar with that when she stayed in an Airbnb for 6 weeks.
It was a mess. There was 15 kids at one point with 2 bedrooms, and there was kids sleeping on couches, on the floor, on air mattresses. There was hardly any food. The staff there were not informed, like trauma informed at all. I can give you examples of them being not trauma informed by like busting down bathroom doors because you're taking too long in the bathroom. That's just that should not be allowed.
Health and Welfare couldn't speak to specific claims from Cadence, but stressed the importance of safety as a priority.
Certainly the youth's needs are the very most important for us. Obviously you're talking about food and clothes, a comfortable place to sleep, medications, all of those things come into play. So we talked about short-term rentals and about getting out of that temporary housing. That's sort of a synonym for the short-term rentals, temporary housing. And that's an ideal location, similar to the Payette Assessment Center, is where we, if a community-based setting isn't available, where we need these kids to be safe.
Pro is referring to the new facility that opened in May with 16 beds for kids in foster care. On average, the facility has 12 to 14 kids awaiting placement. With a new director at Health and Welfare and a new leadership team, the agency has stressed that it is hyper-focused on improving the foster system for kids in care.
At times, there might be a need to support kids in a temporary housing scenario. At one point, we had 8 temporary housing locations in the state of Idaho.
The department announced in November that it had closed all of the temporary housing locations and increased the number of available foster family homes. While improving foster care is vital, preventing children from entering the system at all is also a priority for Health and Welfare.
Prevention intervention is a space that has proven nationally and in the state to be effective. It's oftentimes the least expensive option if you think about what happens potentially afterwards. So we are wholly invested in prevention intervention to keep that family unit whole. So what that looks like practically on a day-to-day basis could be one of our workers providing direct delivery of services to bio mom or dad. Let's say they have their own maybe substance use issue or behavioral health challenge. Maybe it's direct delivery of services to the youth. Maybe they have their own trauma-based needs that we need to address. Sometimes that looks like brokerage of services to the community, so maybe they do family counseling together. So it's sort of a multi-pronged approach to prevent and intervene, ultimately to avoid any kind of ongoing safety issue, because keeping that family whole is so critical to the success of not only that youth, but the family as a whole, and honestly the community, because it starts at home.
Idaho, like other states, does have a disproportionate number of children of color taken into foster care. Pro hopes to address the issue through prevention.
It's absolutely important and critical that our workers meet the families where they are, both in issues surrounding culture and race, and certainly issues surrounding safety of their youth. So our staff are trained in meeting those needs and meeting those families where they're at, and that's what we would look towards to continue on. And prevention intervention spaces will then look towards those numbers, and you'll see those numbers look a little different as we move closer and closer and farther upstream from a removal and keeping those families whole.
Increasing the number of foster parents in Idaho has been successful, but more are always needed.
Foster families are critical in making sure we have right placements for kiddos. We were excited to share that July was our highest licensing month in the last couple of years. Starts with training, of course. After you license the home, to make sure it's safe, you also want to make sure that foster families are trained in the reasonable parent and prudent standard. And then we've also layered on trainings for foster families who may want to take additional types of kids. So let's say they want a kiddo that has maybe some JJ or juvenile justice experience or some trauma background. There's trainings we offer for those foster families to make sure before they get those kiddos and before those types of kids are placed in their home that they're prepared for that.
Recent efforts to recruit foster parents included a new foster parent Bill of Rights issued by executive order from the governor, as well as free parks passes for foster families. Cadence worries the foster parent Bill of Rights gives foster parents more rights than foster children.
I see it as something that is going to be absolutely detrimental to kids in the future.
There is an Idaho Youth and Care Bill of Rights for foster children, but Cadence says she only remembers signing something once when she came into care at 14. She didn't always know her rights when she was in care. The legislature did establish a new state office of the Ombudsman, who would operate independently of the courts and of the Idaho Department of Health and Welfare. The office would establish a procedure for receiving, examining, and resolving complaints regarding children under state supervision. Complaints could come from foster parents or biological parents or teenagers or others involved in the state foster care system.
I think that is going to be a huge step towards assisting and giving foster youth a little bit more of a voice.
Today, Cadence is working on a degree from the College of Western Idaho using funds she's entitled to through the Extended Foster Care Program, established in 2021. She doesn't want to be just another societal stereotype about foster kids.
We've had our life taken away from us, and then we're thrown into foster care with the expectation that it's going to get better, but it's doing more damage than good.